Welcome to our webinar. We're here from Northeast Georgia Medical Center's Bariatric Weight Loss Center, and today we're going to do a webinar on options for weight loss. I'm going to introduce you to my team. First, my name is Amy Smith. I'm the Bariatric Program Manager here at Northeast Georgia. I have my colleagues with me. I've got Aaron Perez. He is our full-time therapist, behavioral health specialist. He helps us with individual counseling and some support groups. And then I have Giselle Cram-Ortiz. She is our full-time bariatric dietitian, and she also happens to be a chef. So I'm gonna have her talk a little bit about her role here in just a little bit. I have Claire behind the scenes, and she's got a list of questions that have been submitted. Claire, what's our first question?
Okay, so who is a candidate for weight loss surgery?
I'm glad you asked that, actually. There's a misnomer about bariatric surgery. Sometimes people think of some of the reality shows of the patients that are seeking weight loss surgery, but in reality, about 50% of our patients last year here at Northeast Georgia actually had a BMI between 35 and 45. So to be a candidate for surgery, someone would need to have a body mass index or a BMI of 35 or greater. And to put that into perspective, if we look at a female who has the height of 5'2", if she were to have a weight of 195 pounds, she would be a candidate as long as she had a health condition related to obesity. If we had a female who was 5'4" and she weighed in at 205, she would be a candidate. If we had a male patient who, on average in the United States, we have a height of 5'9", weighed in at 237, that patient would be a candidate for weight loss surgery as long as they had a health condition related to obesity.
Okay, so what type of surgeries do you perform in the program?
Right, so most of the surgeries that we do here are the sleeve gastrectomy and then the Roux-en-Y gastric bypass. Now, some patients a lot of times will ask me questions like, isn't weight loss surgery drastic or isn't it dangerous? And the reality of it is there's about 40 other chronic health conditions that are related to obesity. And if we can treat that underlying disease of obesity, many times we can get those other health conditions to go away. With weight loss surgery, it's very different than when it was 40 years ago. And so we've been able to really improve the surgical techniques. And today, bariatric surgery is as safe as having their gallbladder removed.
So what are the common health conditions that weight loss surgery treats?
So the majority, or the most common rather, diseases would be type 2 diabetes, gastric acid reflux, or heartburn. Those are two of the main reasons that people actually undergo weight loss or metabolic surgery, because with type 2 diabetes, we can put it into remission about 80% of the time, specifically with the gastric bypass. And one of the main treatments for acid reflux or chronic heartburn is the gastric bypass. But there's many other diseases like high blood pressure, high cholesterol, that we can get rid of about 75% of the time. And about 79% of the time, we can get rid of chronic sleep apnea as well.
So how would someone get started in the program?
So the best way to get started would be to reference our website. So if you were to go to NGHS.com/bariatrics and then -101, that's going to take you to our Bariatrics one-on-one landing page. And you can either sign yourself up for an in-person class, or you can click to watch the seminar any time of the day or on the weekends, whenever it's convenient for you.
Okay. So if someone isn't ready for weight loss surgery, what other options do you have in the program?
Well, another option would be nutrition counseling with a registered dietitian. If you have never done nutrition counseling, I would absolutely recommend that as something to try out initially. If you have done nutrition counseling and you're looking for a different option, we also offer intragastric balloons, which are balloons that are inserted into the stomach pouch. And the way that they help patients lose weight is that they occupy space in the stomach, and therefore it limits the amount of food that patients can eat at a time. The balloons are inserted for about 6 months. They stay inside the stomach, and then they're removed. Patients have guidance, help from a registered dietitian all throughout the program for a total of 12 months. So the dietitian helps the patients transitioned from having the balloons inserted to maintaining those lifestyle changes after the balloons are removed. Another option as well would be medical weight loss, which would involve supervision from a physician, usually meal replacements, visits with a registered dietitian to develop a plan. And a lot of times it would involve as well medications to help with the weight loss by reducing appetite, for example, or any other anti-obesity medication.
Okay, if a patient were to schedule a nutritional counseling appointment with you, what could they expect?
Sure. So initially, in the beginning of the appointment, I do a very in-depth assessment of my patients. Every patient is different, individual, so I do an in-depth assessment of their medical conditions, medical history, their typical meal pattern, what they've tried in the past to lose weight, what they have not tried. And based on that, I can develop a proper diagnosis and plan. Like I said, my consultations are very individual, so what I recommend to one patient, the plan that I recommend to one patient may be different to the plan that I would recommend to another patient. I do in-depth nutrition education during my sessions. For me, it's very important that my patients not only follow a specific meal plan that I've recommended, I also want patients to understand why they're following that meal plan. So I want to make sure patients leave my sessions fully understanding of the nutrition information. And also I help patients be accountable by maybe asking them to send me weekly food journals. So I keep contact with my patients on a weekly basis. I usually follow up in person or via telehealth once a month, but I try to keep in contact via email on a weekly basis. Patients send me their food journals and I provide feedback. Or some patients, I ask them to actually take pictures of their foods and send them to me. It's another way of, a different way for me to monitor how well they're following the program. So it helps patients stay accountable all throughout the process.
Okay, Erin, this question is for you. What is your role and how do you support patients in the program?
Yes, I'm the behavioral health specialist with the bariatric clinic. I do the initial mental health assessments, and mainly, we focus on how patients have an emotional attachment to food, and with their certain if they have coping strategies already in place with that they fall back onto with food or overeating or whatever that relationship may be. And then try to break that down and look at how their thoughts and their feelings and their behaviors and choices all interact and play in that dynamic in reaching their weight loss goals.
Okay. Do you offer support groups?
Yes, we have support groups with alumni and patients who can come together, and I conduct the groups, and we're doing some online, and you can see those on Facebook, and we have also links on YouTube. It allows patients that have been through the bariatric process and weight loss process to come together, share ideas, their hope, their stories, their experiences, what has worked, what's not worked with them. And use each other as a peer support, really, emotionally, and through all the mechanics of their weight loss recovery. I'm there, of course, to bring that element of support and information, guidance, counseling from the mental health perspective, the behavioral health perspective, address any kind of environmental or multidimensional facets, influences, barriers that maybe get in the way of our patients and slowing down or inhibiting the progress towards the goals that they're trying to make.
So what kind of support can I get if I live a long ways from Gainesville, Georgia?
Well, we have telehealth available, and we can make arrangements for sessions to be done through YouTube or the Zoom format. We can also do it simply through telephone and through audio if necessary. Patients can also see us coming together for our group on the YouTube and the Facebook platforms and still be a part of participating in groups and submit questions and interact that way as well. And do it remotely, do it from their home without having to make those kinds of long distance trips. Still stay connected to the community.
Okay. What are some common mental health challenges faced by bariatric patients?
One of the most common ones is what's called emotional eating, or being like head hungry, where patients have become so kind of conditioned to eating and before really registering that they're full, or falling back on food as they're just use themselves to feel comfortable, to feel safe, all of those kinds of emotions that may involve feeling better or comfortable. And so that's usually the first thing that comes up is, if I meet with somebody, it's pretty common that one of the challenges is, I eat out of boredom, or when I get stressed out, I eat, or, trying to break that dynamic of, feeling uncomfortable, feeling unsatisfied, or feeling vulnerable. Usually it's a negative kind of an experience, and then the food that they've come to depend on and enjoy helps to kind of see that and smooth it over. Some other challenges sometimes can be just the sheer convenience of food and the affordability of it, particularly with fast food, and just the ease of it, and getting habituated over the years and decades of just doing that kind of behavior, just, kind of like not really mindfully thinking about what we're eating, the choices that we're making. So a big part of treatment that I focus on is really breaking down and itemizing what that looks like with patients. Like, what's a typical day that you go through? What does it look like when you feel hungry? What are you thinking? What are you feeling? What's the thought process? And looking at ways to change and adapt some of these choices and behaviors that is a lot easier said than done. And I think that's where a lot of families and friends and people maybe sometimes that try to be supportive, but maybe don't quite understand the difficulty that our patients face with making these lifestyle changes, because they're so ingrained, in all of us when we pick up these habits that, just being shamed or, being talked to or told or lectured is not going to change these behaviors. It takes a lot of support, it takes a lot of emotional support. It also takes a lot of planning and thought. I think almost all patients I meet are aware and know that there's like a problem, there's something they want to change. They understand what's healthy and not healthy. It's usually like the challenges and the problems they're having with just instilling new lifestyle changes and habits and keeping that routine going.
Okay. Amy, so how would a patient schedule an appointment with Erin or Giselle?
Right. So by calling our office number at 770-219-0446. Erin is based here in Gainesville, but as he said, he can do telehealth. Giselle actually sees patients physically in Gainesville and in Brazelton, but she can also do telehealth also.
And what other ways do you support people in the Aftercare program?
Well, just to touch a little bit on what Erin was saying, when our patients go to their primary care, for example, and their doctor's concerned about their health and they feel like they need to lose some weight to regain their health, the doctor a lot of times will tell them, you need to eat better, you need to exercise, but then the patient leaves and that's easier said than done. And so here in our program, we have a lot of different things built in to help support the patient every step of the way. So in addition to nutritional counseling or behavioral health, we have things like opportunities for physical activity. So here in our program, our patients can get yoga. We do bariatric yoga and bariatric weightlifting classes once a month. They can attend in person or they can watch it via our YouTube channel. And what I love about those classes is the instructors are able to guide the patient through, meet them where they are physically, and maybe suggest a different technique or a different position that's comfortable for them until they are able to maybe get in the floor or get in, a position without a chair, for example, with weightlifting. Another thing that we have here in our program is something called the Bari Boutique, and that is a boutique that we specially created for our patients, where our patients can shop out of gently used clothes. And so we've got a private dressing room here. Patients can come and they can just play with different sizes and figure out what size they are, because our patients lose weight very rapidly, specifically with surgical weight loss. And so it gets really expensive replacing clothes. So that's a neat area where they can go totally free. They don't have to donate or anything to take advantage of that. And then I don't know that we mentioned this before, but with Giselle in our program, one of the benefits of having surgery at Northeast Georgia is that they can have nutritional counseling through Giselle for free forever. And so outside of our program, some of those appointments can be very costly. And so that's a big benefit here at our program.
What is the hospital doing to keep patients safe when they come in for surgery?
Yeah, so there's a big concern with the COVID pandemic right now. And so certainly safety is always first on our list. We are a center of excellence in bariatrics, nationally recognized for our outcomes. So we are doing several things. We are actually testing patients prior to surgery to ensure that they are negative for COVID before they even come into the hospital. But we also have a specific unit where our patients all go after surgery, and that is deemed a clean unit, meaning that there are no COVID patients on that unit, and there's also no patients that we suspect might be positive for COVID. Another thing that we're doing is something called same-day surgery. And so not every patient is going to be a candidate for this, but for some patients, their surgeon may decide that they would be a great candidate for same day, which means the patient would have surgery and a few hours later be able to go home and finish recovering at home so that they're not staying in the hospital for a lengthy period of time. Now, our patients that do have to spend the night don't spend very long in the hospital either. So typically our patients that do spend the night go home around noon the next day. So we really try to limit their exposure by getting them home as quickly as possible.
And Giselle, what are you doing in the office to keep patients safe when they schedule an appointment?
Well, I know in general in our department, when we have in-person visits, first of all, when the patient comes into the office, we screen them. Our registration person makes sure to screen them, ask the appropriate questions, and provide masks if they don't have their own. We also make sure to sanitize our areas before and after each patient that we see. We're constantly, washing our hands with soap and water, and we have hand sanitizer in the entrances to every single office space in our department. So we're trying to be very, very careful and very meticulous on how we do things here for the cleanliness.
Okay, Amy, where can patients go for more information on the program?
Right. Well, the best place for them to go to is our website, because there's a ton of information that you can look at there. So our website again is www.nghs.com/bariatrics-1-on-1. If you go there, you're going to see something that says Get Started Now, Bariatrics 1-on-1. And there are two options. We actually teach 2 in-person sessions every month, every other week on a Wednesday, the second and the fourth Wednesday of every month. But then here we have our online seminar, so you can watch it any time of the day. I highly encourage someone, if they're interested in surgery, to watch it with a family member or a friend, whoever you think might be your biggest support person, so that they can hear that firsthand information at the same time. After watching that seminar, then we can go ahead and look at getting that patient set up with a consult with a surgeon. The way that I look at the first appointment with a surgeon, it doesn't mean that you're going to go to surgery the very next day. What it means is that you're actually going to a specialist for their opinion on your specific condition, your specific outcome after weight loss surgery. So I look at that initial appointment with a surgeon as just some more information gathering to get your questions answered, to decide for yourself if this is the right choice for you. So that's our website. And then again, our phone number is 770-219-0446. Thanks for joining our webinar.